Poison ivy is a very common plant found here in Indiana, and people that are sensitive can develop quite a severe rash that's itchy and can cause swelling and a lot of discomfort. So the most important thing is stay away from it. What's it look like? It's got 3 leaves and a red stem. Learn to identify poison ivy. It's quite easy to identify. There are some things like Virginia creeper and other plants that actually look like poison ivy, so just make sure you know the difference. But if you're outside in the garden or you're out in the woods, make sure you know what it looks like, and if you are sensitive, stay away from it. I personally am a sufferer of poison ivy, so I can identify the poison ivy plant from a long distance because I've had it so many times and I never want to get it again. So if you do happen to be exposed to poison ivy, how is it spread? There's a lot of myths about how poison ivy is spread, but generally what happens is there's an oil on the plant touches your skin, and then that oil actually penetrates the skin and causes a skin rash and the immune system to react, where you get a lot of swelling, redness, itchiness. The most important thing is if you're exposed to poison ivy, when you come in from the outdoors, take the clothing off, wash it in hot water with soap, and then take a shower immediately and use soap and water with a washcloth and try to get all that oil off your skin where you may have been exposed. Sometimes actually just getting the oil off before it has had time to penetrate and cause that immune reaction is enough to prevent poison ivy. Is poison ivy spread from human to human? Absolutely not. There's a lot of myth, people think they're spreading it around their body or they're getting it from, another person. That's not true. Now, you can get it from your pets. So your animals, they can carry that oil on the coat of their fur, and then you pet them. So yes, pets can definitely carry that. That's a situation where you often don't even know that you're exposed. But the most important thing is do not scratch it. If you scratch it, you have bacteria under your fingernails. You can end up with an infection in your skin. It can just prolong the case of poison ivy because you keep it constantly inflamed with your scratching. I know that's hard. I've had severe cases of poison ivy in my years, and it's almost impossible not to scratch when you have so much of it all over your body, but do your best to not scratch. So if you do get poison ivy, what's the best solution? So what I recommend is you take 6 parts water to 1 part white vinegar. You can use any kind of vinegar, honestly, and then you mix that solution together. You put it in a bowl, and you can take either a washcloth or paper towels, saturate those, put those on your skin, and then let it dry, and then dab your skin, let it dry, dab your skin, let it dry. You can do that 2 to 3 times a day. What that helps is draw up that irritation and the rash that you get. And if you do get poison ivy, you can do the vinegar soaks, and then I like to apply something called Blemex cream. This helps reduce the inflammation, helps take the itch away, and can help clear it up faster. A couple other over-the-counter remedies are calamine lotion and oatmeal baths, and that just helps dry everything up and soothe the skin. Calamine lotion helps kind of dry it up as well. There's really no issue with using that. A couple other things, just from a symptomatic relief from the poison ivy, the itching can be intense. So there are some things that we have here in the pharmacy. We have a product called Histoquel, which actually helps stabilize the mast cells and reduce the release of histamine, which causes a lot of the redness and the itching. And then we also use something called Cytoquel, which can actually help modulate that inflammatory immune response. So those are 2 things that you can take in the event that you do get a severe case of poison ivy to help with symptom relief and help you feel better faster. When do you need to see a physician about poison ivy? Well, generally, if it involves more than about 25% of the body surface, then I would definitely recommend you see a doctor. In those cases, sometimes we'll use steroids because the inflammation can be quite severe and debilitating, and we actually have to give a course of steroids. The mistake that many physicians make, and urgent care providers often make this mistake, is if they give a patient steroids, they don't give it to them long enough. So the problem is, if they get, say, a 5-day course of steroids, the course of poison ivy takes about 10 days. They're feeling great at like day 5, and by day 6 or 7, then it comes back. They really did a disservice to that patient. So if you do seek medical care, make sure that you get the proper treatment with the proper length of therapy to make it effective. And sometimes when people are burning firewood, it actually has poison ivy on the wood. They burn that wood, and then the oil gets vaporized, and if they inhale that vapor, they can actually get a severe allergic reaction in their lungs. That is a time to seek medical attention immediately. Quite rare. Just beware of that. Hi, thanks for watching the video today. When I have time, I love to make these videos because I love to educate about health and wellness. If you enjoyed this video, please make sure and subscribe and maybe check out this next video. YouTube thinks you're gonna like this one. If you have any questions you'd like me or my team to answer, please leave them in the comment section below. See you in the next one.